What makes these photos disturbing isn't the blood. It's the dignity stripped away. 10 moments show surgery before routine anesthesia and sterility, where speed and restraint replaced comfort and consent. You'll see ungloved hands, wooden tables, and tools left coated between patients. Then, the subtle clues of change. Masks, scrubs, a reclining bed hint at a safer future. By the final image, you'll understand how fragile progress was and how close every operation came to disaster. Watch on to confront the blunt reality behind the word procedure. Before we move on, please take a moment to subscribe to the channel and like the video. Number 1. Amputations without anesthesia. The clock was the drug. Speed meant mercy when there was no pain relief. A cramped room closes in. A saw flashes. 2 assistants pin a limb while the surgeon cuts fast, then ties vessels in a flurry. Minutes decide shock, bleeding, and who goes home. They trained like stage acts for timing and nerve, but haste frayed edges. Ragged cuts bled more, and air, cloth, and hands loaded wounds with risk. Clean meant what eyes approved, not what microbes feared. Ether and chloroform existed, but not everywhere, not trusted, not ready. Supplies ran short. Some feared side effects. So success hinged on a straight cut and quick ligatures, yet deaths still hovered high in the pre-lister ward. These photos don't chase gore. They show a system built on nerve and a ticking watch, which is why pain control later felt like rescue. The clothes on the operators tell the next part. Number 2. Street clothes in the operating room. The white coat was a costume that hadn't arrived yet. Photos show surgeons in street suits and stained aprons, hats still on, sleeves rolled. No gloves, no masks. Authority wore wool and silk, then leaned over open wounds as if at a desk, not a theater of risk. Status spoke through fabric, but cloth trapped life. Without clear rules for sterilization, the room itself carried disease. Bed linens went unwashed, and coats walked in from the street to the table, turning confidence into a carrier. Pre-lister, clean meant sight and scent. Then carbolic acid, hand washing, and sprayed mist began to shift the script, like a new set on a familiar stage. Masks arrived later, and many balked. Gear felt awkward, unmanly, slow. So what looks like professionalism now reads as danger. Antisepsis rewrote the dress code. When outfits could not protect, restraints did. Number 3. Restrained patients in live operations. The straps weren't for safety. They were for silence. Wood planks held the frame. Leather ties crossed wrists and ankles. Assistants stood close, bodies braced, hands firm on shoulders and knees. The patient stayed awake. A shout, a gasp, then stillness forced by grip and gear, because any drift could ruin the field and flood it with blood. Movement meant disaster. One flinch could widen a cut or tear a vessel, but the restraint itself carved fear into the memory. The room often had watchers. Public viewing was a norm, like a lesson on stage, and that gaze pressed down as hard as any strap. Assistants worked as nurses and clamps. They steadied limbs, dabbed sweat, kept the line of sight clear. Restraint answered the absence of anesthesia, not cruelty as rule. These images fix on dignity taken, where control came by force. The tools waiting nearby tell another truth. Number 4. Blood-streaked tools on wooden tables. The table was porous, and so was the logic of cleanliness. Saws, knives, and clamps sat on raw boards, wiped with a cloth, then used again. The wipe cleared color, but not life. In rooms where clean meant neat and odor-free, a glossy surface counted more than an invisible threat. Wood took in blood and kept it. Joints and grain hid residue that water could not reach. Without wide belief in germs, tools were arranged like a craftsman's set, ready by sight, not by safety. Then carbolic spray met habit, and boiling moved from rumor to rule. Metal trays replaced wood, because smooth steel offered no hiding place. Later, steam sterilizers made heat the guard at the door. That bench, stained and practical, splits eras, craft on one side, science on the other. And on those boards, even a neat job seeded a fever. The trophies some surgeons kept were far worse. Number 5. Posing with amputated limbs. The photograph doubles as proof and performance. Surgeons cluster around amputated limbs, eyes fixed on the lens. The frame says, "Job done and lives saved," but the stagecraft shows. The limb becomes a prop, the table a set, and the camera the audience that will carry this scene beyond the room. The pride reads clear, yet a cost lingers. Patients turn into exhibits. Their loss stands in for mastery, and the snapshot hardens that trade early medical photos recorded outcomes, built names, and fueled lectures and pamphlets like traveling exhibits that sold expertise. Consent sat in the background, thin or missing. Display felt normal in a world that saw surgery as public craft, not private contract. These staged images show surgery as spectacle and commerce, laying ground for later fights over publicity and patient rights. Training the next generation often began on those who had no voice. Number 6. Students on unclaimed bodies. When no family claimed the dead, education laid claim instead. Dissection rooms turned unclaimed and poorhouse bodies into the silent class. Students stood in tiers, coats buttoned, scalpels lined up like a toolkit, while instructors traced planes of muscle and nerve. The lesson taught anatomy, but the bargain ran one way. Those with least protection gave the most, and the camera caught that imbalance as plainly as a ledger. Cadavers came through laws that routed the unclaimed to schools. Scarcity had earlier driven grave robbing, which then pushed reforms that tried to regularize supply. Debates flared in lecture halls and atlases. Were the figures on the page clean knowledge or borrowed from lives denied choice? The moral stain clung, even as skill advanced. These photos ask a hard thing. Can life-saving skill be learned from ethically dirty sources? In the living, the skull became the frontier, and drills were blunt. Number 7. Primitive drills for brain surgery. A hand-cranked brace met the human skull. Early brain work borrowed from the bench. Trepanation and drainage used brace and bit drills, toothed saws and rongeurs shaped like shop tools, chosen for grip and control rather than delicacy. Millimeters decided life. With no imaging to guide depth, surgeons read scalp swelling, eye changes, and pulse shifts, then eased pressure a turn at a time, while every pass risked a laced artery, a tear in the dura, or a sudden bleed. Antisepsis crept in and steadied hands. Carbolic dressings, boiled steel, and clean fields cut meningitis and ward fevers. Masks and gloves, awkward at first, blocked droplets and skin oils. Later, local anesthetics numbed scalp and bone, turning screams to tight breaths. What looked like guesswork seeded a craft. Precision grew in rough rooms once germs were named. In war zones, rough rooms moved to the field. Number 8. Civil War field operations. A tent, a table, and a queue of wounded men. Field hospitals ran on volume. Limbs were cut fast, instruments passed hand to hand, and water ran short. The line moved by need, not comfort. Surgeons raced the clock and gangrene. Triage prized speed over polish because delay meant death, and infection stalked every stitch. Heroic work met a dirty field and paid for it later. Mass casualties forced steps into a script, like a drill taught on repeat. Cut, clamp, saw, dress, move on. Standard moves eased chaos but could not cleanse it. Cleanliness got early nods, rinsed tools, fresh cloth when possible. But supply drew a hard line. These images lock in a race against time era. Bravery stood tall, yet the system bent under microbes no one could see. Dentistry in towns echoed the same pain logic. Number 9. Tooth pulls without relief. The loudest surgeries happened in the smallest chairs. Street dentists and backroom clinics pulled rotten teeth with forceps and leverage. No numbing. A helper cupped the head, another steadied the jaw while the operator twisted until the root gave or the crown snapped. Mouth pain could turn septic and lethal, but the tools spread more germs. Shared forceps, rinsed in a basin, carried yesterday's infection. Many delayed care out of fear, then arrived when swelling and fever set the terms. Relief crept in slowly. Cocaine derivatives numbed gums. Then Novocaine made blocks reliable and brief. Gloves, masks, and boiled steel followed, and the autoclave turned heat into a quiet guardian for the mouth. These rough extractions show the core truth. Without anesthesia and sterility, even minor care was a public ordeal. The outcome often landed back in the ward, overflowing and infected. Number 10. Wards of post-op infections. Success in the theater, failure on the ward. Rows of beds tell it plain. Bandages seep, fevers rise. Sepsis turns yesterday's win into today's loss. The air hangs heavy, and the line for water runs long. What worked under bright lamps unravels by nightfall. Hospitals concentrated danger. Poor air, shared linens, and dirty hands pushed deaths toward that grim baseline. Normal practice meant reusing dressings and pocketed tools, which spread what no one could see. The result fills every frame. Victory, then decline. Then the tide shifted. Antiseptic dressings, steady hand washing, and nurse-led order cut the chain. You start to spot the change in small props, masks and gloves, metal trays, reclining beds that keep the chest clear. Clean lines replace stained cloth. By the last images, the triumph is quiet. Clean hands. Boiled steel. A mask. Control, not heroics. The arc bends from spectacle to system, a quiet revolution.